Jennifer Noble is a 42-year-old female with a past medical history of IDA presenting with increasing fatigue, as well as decreased concentration and an increase in craving to chew ice, specifically the Sonic ice, as she's consuming several cups of this a day. All these symptoms began several months ago and have seemed to worsen. She describes this craving to chew ice as irresistible and often interfering with her daily life. She also reports a persistent crawling or tingling sensation in her legs that comes with the urge to move them. This sensation keeps her up at night, but seems to be relieved with moving the legs and getting up and walking. Importantly, she has a history of IDA that was previously treated with oral ferrous sulfate. However, she stopped taking this several months ago as it gave her GI upset, specifically abdominal discomfort and constipation. Of note, she does report heavy menstrual cycles lasting 6 to 7 days, along with production of clots and then increased fatigue during that time of menses. She denies chest pain, palpitations, fevers, weight loss, or any recent infections. She also denies melena, hermatochezia. She's not had any recent colonoscopy for us to review, and then otherwise all other review systems normal. Her past medical history includes IDA as well as poorly controlled type 2 diabetes and seasonal allergies. She has no prior surgeries. Family history consists of IDA in her mother as well as type 2 diabetes in mother and father. She does not smoke, and then she drinks occasionally on social settings, and then she works full-time as a teacher, lives at home with her husband and 2 teenage children, and then denies any recent travel, dietary changes, or known toxin exposures. Physical exam, the patient appeared well, was not in any acute distress. All vital signs were within normal limits. There was notable conjunctival pallor and dry mucous membranes. Cardiovascular and pulmonary exams were normal, no murmurs or abnormal breath sounds. And then abdominal exam was soft, non-tender, no organomegaly was noted. Neurological exam was non-focal, no peripheral edema or lymphadenopathy either on exam. And then our differential diagnosis, number 1 is iron deficiency anemia, given her classic just clinical features of pica, fatigue, restless legs, and then history of menorrhagia. Other differentials include anemia of chronic disease, thalassemia, trait or carrier, and then B12 deficiency, which would give more macrocytic picture, and then also bleeding causes, so like a GI gastric ulcer going on, a bleeding colorectal polyp, or presence of a GI cancer, which would be a big, bad, scary that we'd want to rule out. And then for labs, we went ahead and ordered a CBC as well as iron studies, which revealed a hemoglobin 8.1, hematocrit of 25%, and an MCV of 72, all consistent with a microcytic anemia. And then her ferritin was critically low at 5, with a serum iron of 20 micrograms per deciliter, and then an elevated total iron capacity, binding capacity, and a transferrin saturation of just 5%. These values were all diagnostic for iron deficiency anemia. Her B12 and folate levels all came back within normal limits. And then there was a fecal occult blood test that was ordered just to rule out some GI bleeding, renal function, and inflammatory markers, including CRP and ESR, all came back normal, making anemia of chronic disease less likely in this case. As far as plan goes, we decided to go ahead and start her on IV iron, just considering her significant symptoms and then really low iron labs, as well as intolerance of oral iron in the past. So she will receive IV Injectifer, which is administered in 2 separate doses, usually a week apart, at our infusion center. We discussed the risk of transfusion reactions, which is super uncommon but may include dizziness, itching, or pain at the injection or the infusion site, although that's really low risk with this specific formulation of iron. And then we also counseled on the improvement that we expect to see within 24 to 36 hours, and this is going to be improvement in energy levels as well as reduction in that pica and restless leg syndrome, so she should get better sleep. And then we also counseled on an iron-rich diet that she can continue to incorporate in her daily lifestyle, such as red meats, leafy greens, and then legumes, things like that. However, given the severity of her anemia, just dietary changes wasn't going to be enough, but it works great with conjunction with the therapies. We also plan to coordinate with her OBGYN to discuss treatment options for her menorrhagia, which can help nip this kind of at its root, which can include hormonal therapy, tranexamic acid, endometrial ablation. Kind of depends on what her outlook is as far as having any more kids, but we definitely include them in our note and plan to schedule close follow-up with them as well. Hi Jennifer, so what you're experiencing is a type of anemia, which means your body is not producing enough healthy red blood cells to effectively deliver oxygen everywhere it needs to go in the body. In your case, this is because you have low iron stores, which is needed for blood cell development. And so this is pretty typical for someone your age who has heavy menstrual cycles. When we think about iron deficiency, we know this either comes from poor intake of iron, which is not common here in the US, poor absorption of iron, which can be common and has a genetic component, or we're losing blood somewhere. This is the most common reason, especially in younger females who are still menstruating, especially if they have heavy menstrual cycles. We know where that blood's going. If that were not the case for you, then we would be more concerned about some type of GI bleed, which we're going to rule out anyways, but much less likely in your case. This is the reason you're having those symptoms of fatigue, shortness of breath, and then craving of ice, which we call pica. And that specific symptom is super specific to iron deficiency anemia alone, which is a great way that we can kind of confirm this is what's going on, and really cool that it can disappear within 24 to 36 hours after getting iron repletion therapy, which is great. And kind of some history with that is your brain is such a big iron consumer, so it makes chewing ice so attractive to it is kind of that gritty feeling. It reminds your brain of dirt, which is where they used to get iron back in the day. Whenever people had iron deficiency, they would chew on dirt for that. And so you don't get iron from the ice, but it's a true craving that your brain kind of requires you to chew on. So we'll see that go away, as well as the restless leg syndrome. Because you have a poor history of oral iron intake and just GI upset, we'll avoid that. We're going to go ahead and start you on IV iron. You're going to take this in 2 doses, usually a week apart. And it can replete the same amount of iron you would get from oral therapy over 6 to 9 months all at one time, which is great, really good at restoring those lab values, which we'll check again in 4 to 6 weeks to make sure those have come back up. But low side effect profile with this, people tolerate it generally super well. Only things to look out for, which comes with any IV drug, would be just itching, dizziness sometimes, or chills, maybe pain at the infusion site, but all that's low likely, just something to keep an eye out for. And then we are going to work closely with your gynecologist to try to tackle this menorrhagia at its root. She's going to discuss to you more about treatment options as far as birth controls, other type of medications or procedures that can decrease that blood flow and hopefully keep those iron levels maintained to get you feeling better soon. Please let us know if you're experiencing any new or changing symptoms over the next few weeks, especially after you receive therapy.